But one thing we should know is what we are talking about here is deadly serious. And I know that some of my colleagues, have talked about bringing forward a proposal that would ask the majority leader here in the Senate to bring forth a Democratic proposal to deal with this crisis. And it would be a strong proposal. But unfortunately, that would be a very wasteful and fraudulent gesture. It would mean nothing. Because no matter what happened with that proposal here, and I don't know that it would pass, I suspect some Republicans might vote for it, it wouldn't matter one bit, because unless you have the commitment of the Speaker of the House that he will support it and that the President of the United States will sign it. And we certainly do not have that commitment now. So all it would be is a kind of wasteful gesture. People could feel good. They'd vote for a bill with the full understanding that bill would go nowhere and premiums throughout this country would double. So where do we go from here? Well, short term, we cannot allow millions and millions of people to see an outrageous increase in their premiums when they simply cannot afford it. That would be a disaster. We cannot throw 15 million people off the health insurance they have. But some of my Republican colleagues I hear have come to the floor and they're saying, you know what? These insurance companies are making huge profits. No kidding. Gee, that is something that some of us have been talking about for decades. And so are the drug companies. In fact, the function of the current healthcare system is to do precisely that. What is the function of the American healthcare system? It's to make huge profits for the insurance companies and the drug companies to pay their CEOs outrageous, really crazy salaries, tens of millions of dollars a year. That's the function of the American healthcare system today. You know, Mr. President, in my own state of Vermont and throughout this country, including Louisiana, I have talked to a whole lot of people. And almost always in my remarks, I ask a very simple question. I say, tell me, how many of you believe that the American system is working well, American healthcare system? How many of you think it is broken? And whether it's Louisiana, Vermont, or any place else, overwhelmingly people understand the American healthcare system is broken. It is outrageously expensive. It is cruel. It is dysfunctional. Not a secret. I'm glad that some of my Republican colleagues are beginning to catch on. Mr. President, as I think you know well, we spend almost twice as much per capita on health care as any other country on earth. Unbelievably, this really is. According to the most recent data, here in the United States, we are spending $14,500 per person on health care. $14,000, over $14,000 for every man, woman, and child. And let me tell you how that compares to other countries. Somehow, in Japan, they're able to provide health care to all for $5,600. In the UK, $6,000. In Australia, $6,900. In Canada, $7,000. And $7,100 in France. In other words, major country and major country around the world manages to guarantee health care to all of their people as a human right, and they're spending less than half per capita than we are spending. And I can tell you, having been all over the country, that the American people are disgusted with that reality. They understand and they believe that health care is a human right, not a privilege, that every man, woman, and child in this country is entitled to health care, no matter how old you are, no matter how young you are, no matter rich you are, no matter how poor you are. While private insurance companies and big drug companies continue to make outrageous profits, over 85 million Americans are either uninsured or underinsured today before the disastrous attack on health care that Trump is proposing. The result, some 68,000 Americans die each year because they cannot afford to go to a doctor, and more than 500,000 Americans go bankrupt due to medically related debt. How absurd, how horrific is that? In America, under this current absurd healthcare system, 42% of cancer patients deplete their entire life savings within the first 2 years of their diagnosis, while 1 out of every 4 of them declared bankruptcy or lost their homes to foreclosure or eviction in 2022. Think about it. It is bad enough to get cancer. It is beyond horrific to understand that your family is going to be financially ruined as a result. Under the absurd American healthcare system, our life expectancy, how long we live, is shorter than every other major country, despite the fact that we spend twice as much per capita. We live 4 years shorter lives on average than people in other wealthy countries, while the typical working-class person in America lives a 7-year shorter life than the wealthy. We also have the dubious distinction of having by far the highest infant mortality rate of any other wealthy country on earth. And as bad as our overall health care system is, our primary care system is even worse. Today, tens of millions of people live in communities where they cannot find a doctor, a dentist, or a psychologist, even when they have decent insurance, and others have to wait months in order to be seen. So unbelievably, again, we're spending twice what other countries are spending. We don't even have enough doctors. We don't have enough dentists. We don't have enough nurses, mental health practitioners, pharmacists, or home health care workers. And 1 out of 4 Americans cannot afford to purchase the medicine their doctors need. So it is no wonder that the American people understand that the current system is broken. So where do we go from here? It's one thing to talk about a system that is broken. It's another thing to have a solution. And I have a solution. Not a radical idea. In fact, in many ways, it just emulates what goes on in every other major country on earth. It is to say that health care is a human right, that we need universal health care, and that we must pass a Medicare for all single-payer program. So what is that legislation? What would it look like? What that legislation would do is provide comprehensive health care coverage to all with zero out-of-pocket expenses. And unlike the current system, it would provide full freedom of choice regarding health care providers. No more insurance premiums, no more deductibles, no more co-payments, no more filling out endless forms and fighting with insurance companies to get the coverage that you paid for. No more networks to be treated by a doctor who is not in your network, who can charge you some astronomical cost. And it would also mean, when we talk about comprehensive, the coverage of dental care. Last I heard, dental care is health care, vision, hearing aids, prescription drugs, and home health care. And importantly, when we have a Medicare for All program, it gives Americans the freedom to switch jobs without losing their health insurance. Right now, you got millions of people who are staying at a job that they don't like because it provides decent health care to their families. That is kind of crazy unto itself. And under our legislation, health care becomes a human right guaranteed to all and not a job benefit. If there's a recession and people lose their jobs, they lose their health care because their health care is tied to their jobs. We saw that during the terrible COVID pandemic. And everybody gets access to the same quality health care. Yes, workers at McDonald's, here's a radical idea, workers at McDonald's deserve the same quality health care as executives on Wall Street. Well, would a Medicare for all health care system be expensive? Yes, it would. But while providing comprehensive health care for all, no more out-of-pocket expenses, no more premiums, no more deductibles, it would be significantly less expensive than our current dysfunctional system. Now, why? Why would that be the case? Well, because it would eliminate an enormous amount of the bureaucracy, profiteering, administrative costs, and misplaced priorities inherent in our current for-profit system. The function of the current system is to make profits for the insurance companies and the drug companies. That's what this system is about. And built into that system is all kinds of disincentives for quality and inexpensive care. In fact, the Congressional Budget Office has estimated that Medicare for All would save the American people $650 billion each and every year. On the Medicare for All, there would no longer be armies of insurance employees billing us. Go to any hospital in Alabama or Vermont or any place else. Go down in the basement. You know what you're going to find? Not doctors, not nurses, not people who provide health care. You're going to have people billing you, people hounding you for your late payments. Those people are not contributing to making us healthy. They are part of an administrative system that is costing us huge amounts of money. When you have a simple system, health care for all, publicly funded, it not only substantially reduces administrative costs, it would make life a lot easier for patients, doctors, and nurses who would never again have to fight their way through the nightmare of insurance company bureaucracy. So, right now I am glad that my Republican colleagues are finally being forced to actually talk about health care. I am not impressed by some of the ideas that they have brought forth, but at least it's a discussion. So let me propose what I think is the way out of this shutdown. It ain't complicated. Overwhelmingly, people who consider themselves Democrats, consider themselves Republicans, consider themselves independents, do not want to see these ACA subsidies ended. Not complicated. They don't want to see a doubling in their insurance rates. And by the way, if you end these subsidies, it impacts Republican states more than Democratic states. So people don't want to see it. Is the Affordable Care Act the long-term solution to health care in America? No, it is not. So why don't we do something simple? Why don't we just extend these ACA premiums so we don't double premiums for millions of people? And then why don't we have a discussion about where we go forward on health care? All right? I think that is a common sense solution. So, Madam President, I think I've solved the problem here in the 39th day of the shutdown. Let us have at least a one-year extension. Let's have a debate on health care. Let's involve the American people in health care. Let's put our federal employees back to work with a paycheck. Thank you all. I yield the floor.